We'll give it a minute to let people in. Okay. Well, I think as people continue to come in, let me just say good morning and good afternoon to all of you, to our distinguished speakers and members in the audience. I'm Flori Lazier, President and CEO of the Corporate Council on Africa, the leading US business association focused solely on Africa and connecting business interests on the continent. And I just want to thank all of you for joining us for today's panel discussion titled The Resilient Healthcare Systems Africa Wants. This event is part of CCA's US Africa Health Security and Resilience Initiative, or as we call it, HSRI. And HSRI is a 2-year program that we launched back in 2020. We thought of it even before COVID that there needed to be more cooperation between the public and private sectors, and also between US and Africa in building a stronger, healthier, more resilient African health system. And so this discussion today is exactly the kind that we wanted to look at the strategies and the partnerships between US and African governments, private sector, and other key stakeholders to strengthen health systems in Africa. And so we're delighted to host today's panel on harnessing the strengths of both the public and the private sector, which is critical in addressing not just the COVID pandemic, but really beyond that. And we're looking to reduce a risk and address a range of health system needs, including attracting additional investment into the health sector, increasing efficiencies in delivery and procurements that are made in Africa's health systems, and better managing existing data to expand overall healthcare access for people, as well as the development of the health workforce in Africa, something that is really critical if we're going to have a strong, healthy, resilient African healthcare system. To moderate today's panel, I'm delighted to introduce my friend and colleague, Dr. Landry Signé, who serves as a senior fellow in the Global Economy and Development Program and the Africa Growth Initiative at the Brookings Institution, as well as managing director and professor at the Thunderbird School of Global Management. He is also a distinguished fellow at Stanford University's Center for African Studies. Before I turn it over to Landry, I wanted to just share with all of you some of the housekeeping rules for the Q&A session we have. We invite you to actively put your questions into the chat and use that function. And we're also looking forward to your interventions and engagement with our distinguished panelists. When you submit your questions in the Zoom chat, please make sure to provide your name and your affiliation. And now we're looking forward to a great discussion. So without further ado, let me welcome Dr. Landry Signé. Landry, please.
Thank you so much, Flori, for such a wonderful introduction. It is always an honor and pleasure to engage with you and with the fabulous people that you bring, you connect to make a monumental difference on the continent. So I am Landry Signé, and as Fleury said, so I'm a senior fellow at the Brookings Institution and a professor and managing director at Thunderbird School of Global Management. And I'm very excited to be with you today for this Corporate Council on Africa's US Africa Health, Security and Resilience initiative. I'm particularly excited because it focuses on the resilient healthcare system Africa wants. So I released a report on healthcare last year where I was demonstrating and illustrating how positive relation between the improved healthcare and economic performance could be on the continent. For example, experts estimate that an additional investment in healthcare in Africa on average of $21 to $36 per capita per year over the next 5 years could save 3.1 million lives and generate economic gains of more than $100 billion US dollar over the same period. And similarly, improved health leads to longer life expectancy, better educational performance, increased savings and investment, decreased debt and healthcare expenditure, and more importantly, increased productivity. So you can see that it is incredibly important to improve healthcare outcome, and this could not happen without the collaboration between the public and the private sector, and without the investment of the private sector in many areas where we have tremendous opportunity. So without taking longer, because for this conversation, we have a wonderful panel constituted of distinguished leaders from the public sector, the private sector, and multilateral organization. So we'll have Honorable Janine Mabunda Lioko, who is member of parliament in the Democratic Republic of Congo. Thank you for joining us, Honorable Janine. We also have Mrs. Gwen Mwaba, Director and Global Head, Trade and Finance at the Afrexim Bank. So we are honored to have you with us today. So Mr. Rulani Laniki, who is a cluster lead for Sub-Saharan Africa and country manager for South Africa at Pfizer, and so we'll share the phenomenal experience that we have had during the COVID pandemic with Pfizer. And finally, we have Dr. Stephen Karingi Uneka, Director of Regional Integration and Trade. So let me start by asking you, and we'll start with Honorable Lioko, to share perhaps some stories of successes. So could you expand a little bit more about your role and your experience, Honorable, in the healthcare sector on the continent and in the Democratic Republic of Congo in particular? What is a story of success that you want to share with our audience?
Thank you, and hello everybody. Yes, first of all, I thank you. I thank you, the organization and yourself, for taking the lead about this conversation, which is much rated, and also for all the contributions that we have seen in the past weeks and months about this issue of how Africa has to take his lead regarding the issue of crisis management with the COVID-19. So I think it's true also that we tend to overlook sometimes that Africa can be also a place of tale, a place of success stories. And obviously, I will speak under the angle of Africa and close with DRC, because we feel from DRC Congo that we are in this African region where we fight against the virus. And yes, there is some fact and figures, there is some success stories. I will say, for example, if you look for Ghana, Ghana was so able to innovate by using vaccine delivery by a drone. And this drone was helped or inspired by a partnership that Ghana, the company of Ghana Zipline, had with Pfizer and BioNTech. This is an African story. This is an African success story. There had been also the story of the capacity of South Africa to be able to manufacture the vaccine, where we felt as African that there would be a shortage in overseas vaccine distribution, and all the tribute go to South Africa for being able to replicate a sort of generic product of the Moderna vaccine, although it was without the support, the scientific support of the parent company of Moderna. Then also, if we speak about how Africa tackle the issue, we are very proud as African to see for the first time that we were not fighting for borders or for money anti-IMF or whatsoever. We were speaking the same voice, a united voice, putting on the table our unsatisfaction regarding the lack of justice in vaccine distribution, vaccine access, and vaccine manufacturing. And you have seen our head of state president, whether it's Macky Sall this day at the head of African Union, whether it's the DRC president has African Union head 1 year ago, or South Africa taking the lead with Cyril Ramaphosa to put on the table a united voice to say that Africa has to be heard, Africa has to be respected, and this is our demand and our ask, but we contribute, we are not begging, we are part of the solution too. And going back to my homeland, DRC, I will say that DRC has learned from this kind of virus outbreaks, because we have been famous positively or negatively in the world for having been the first host basin of Ebola. And Ebola was also a violent virus who killed people. And with the lesson learned over the years, we have been able, with the virus outbreak of Ebola, to take measure about how we tackle this kind of crisis. I will give an example. The last Ebola outbreak we had, for example, we were able, just 5 days, after the detection of the first rebound case, we were able to vaccinate 1,800 people in 5 days. And we learned that from the past Ebola crisis and virus. So yes, I think there is African success stories, and I'm happy and open to listen what else Africa can offer on this issue.
Wonderful, and I really like the fact that you highlighted the cooperation, the unique voice that we see, the dynamic that we have seen on the continent during the pandemic, which started, as a matter of fact, also with the African Continental Free Trade Area, where many leaders have started to speak with one voice instead of being divided. And you highlighted also many of the technological innovation. Now I will be turning to Mrs. Ngwen Mwaba. So with your role in trade finance and the Afreximbank, so what type of innovation have you seen, especially as we know that the African Union aspiration of shared prosperity through social and economic transformation require the involvement of the private sector in addressing some of those health challenges?
Yeah, thank you very much, Mr. Moderator, and a warm welcome to everybody that's joining us on the call today in this conversation. I'm representing Afreximbank, which is a multilateral financial institution, Africa-focused for that matter. And the interventions of Afreximbank have actually been on multiple levels. Just to very quickly touch on, the whole of Africa approach in terms of the African Union heads of state coming together and speaking with one voice. Afreximbank was very involved as financial advisor, and by providing a $2 billion guarantee and funding facility to AU member states to enable them to procure COVID-19 vaccines. So that's a great example of a partnership between sovereigns, a multilateral financial institution, a private sector supplier such as Pfizer and other vaccine manufacturers, and working with other logistics bodies to be able to get COVID-19 vaccines to the African countries. However, what I wanted to focus on today and share is some of the forward-looking interventions that Afreximbank has been working on behind the scenes, which we believe are going to be a game changer for the African continent in the health context. Afreximbank has a health and medical tourism program, which largely supports development of health and medical facilities. You know, the bank's interventions under this program are two-pronged. One is a product that we call a construction and medical tourism relay facility, or CONMED. You'll be hearing lots about CONMED in the press, you know, or perhaps through advertisements or access in your individual countries. But basically, this facility was created to leverage financing into the African health and medical services industry to support the development of premier world-class facilities or establishment of existing or upgrading or refurbishment of existing facilities across the continent. Now, the other exciting intervention by Afreximbank, which is probably an even bigger intervention, is that of the African Medical Center of Excellence initiative. And this initiative basically facilitates the establishment of a network of, again, world-class tertiary healthcare facilities right across the continent. And I'm sure many in the audience are wondering, you know, but why an African Medical Center of Excellence? You're a bank. You know, somebody needed to step up, and we recognize that Africa's disease burden is shifting towards a higher proportion of non-communicable diseases. If you look across West Africa, cardiovascular ailments, cancers, hematological disorders are the highest contributors to disease burden from non-communicable diseases. And together, interestingly, they represent 81% of all non-communicable disease mortality. This is quite high. And as a result of these underlying health issues, we estimate that around 1.2 million patients annually need intervention for these targeted disease areas. And Africans are traveling abroad to seek this specialist medical treatment. Africans are spending close to $1 billion each year on medical tourism outside the African continent. And the reason for this is largely because most hospitals are underfunded or they're under-equipped, and they're also inaccessible to most patients, particularly in patients coming from non-urban areas.
Exactly. So those are very important points, and probably perhaps for you to elaborate more and connect. I just wanted to ask you, and I will also come back to Honorable Janine. So the desire of for more resilient healthcare system for member states to strengthen the commitment to increase domestic resource mobilization. Can you connect the trend that you are highlighting with the opportunities that countries have to really support the increased investment in the public health sector?
Yes, no, absolutely. And I was just at the point of coming to exactly that point, because it is the key question, so what can Africa do about it, private and public sector? So if I use the Africa Medical Center of Excellence as a key example, Afreximbank working in partnership with King's College Hospital London, we put out a bid to which we had responses from Nigeria, Kenya, Tanzania, and Ghana. They participated as respondents to this RFP. Nigeria won this particular bid, but basically the idea is to create a 500-bed facility, which will bring those key specialist health facilities onto the African continent, so that $1 billion of outflow that the continent is losing via medical tourism each year can be retained on the African continent. So the experts will be brought from all over the world, including from other parts of Africa, to provide services within this medical center of excellence. And the idea is that several of these centers of excellence would then be set up in other parts of the continent. And then I had mentioned the CONMED facility. That also is a facility that pools resources for private sector that want to develop or refurbish existing facilities. Afreximbank is available to provide liquidity and connect to people like King's College Hospital and other medical facility consultants to help with pre-feasibility studies, the full feasibility studies, and also funding of the construction of these medical facilities so that we can find our own solutions within the continent and keep those much needed dollars on the African continent. Thank you.
Thank you so much. I think those are really wonderful illustrations of the dynamic role played by multilateral, including the Afreximbank on those critical questions. Now, let me turn to Mr. Rolani Kroniki. So, you, as part of let's say, the private sector, you have played a key role during the pandemic, and also we anticipate you playing a key role post-pandemic, given the fact that Africa produced barely 1% of the vaccine which is administered on the African continent. So what are the success stories that you may share, as well as the opportunity coming out of the pandemic in investing in a combination of sub-regional and country-based research, development, and manufacturing to really meet the projected demand in the African healthcare sector?
Thanks, Prof. Landry, and good afternoon to all the participants today. So I'm representing Pfizer. I'm based in Johannesburg. I'm looking after the Sub-Sahara business. And I also happen to be the point person for the discussions around the pandemic, especially on how we can supply vaccines into the continent. And I think to the question you're pointing out about the success stories coming out from the period we've been, I usually just have one word when I describe what has happened. Is the word collaboration, or you can say collaboration or partnership. I've just seen in a huge number of people or sectors trying to collaborate to really bring change in what we're faced with. So I think one success story that you're all aware is that we partnered with BioNTech to come up with the COVID-19 vaccine within 12 months, but that was not enough. What we saw also with governments across as we started to the negotiations and discussions on how to bring the vaccine into the countries was that the mistrust that used to exist between private sector and public sector diminished over a period of time, and quickly so. Because I think all of us really focused on the discussions to say, how do we make sure we bring this product into the continent as quickly as possible? So one of those successes is that when you have a product registered in the developed world in December, and within 4 months of that product being registered and available in the developed world, in 4 months that product is available in Africa, it's actually being in the arms of African children and people. That's something that we have not heard of before, because Africa usually lags behind. So I think that, for me, it's phenomenal that we found ourselves in that position. And for us as Pfizer, it sort of spoke to our purpose about how do we bring breakthroughs that change patients' lives? Because it's one thing to have the vaccine, but we want the vaccine to actually be used by the people that we're making it for. So I think for us to actually achieve that and actually have people using the vaccine as quickly as possible in the shortest time possible, I think that was a success story. But we're not done. What we found was that we continued having discussions with government, and governments were saying, how then do we roll it out? And this is where institutions like the Africa Union, via the Africa CDC and Gwen and the team with Afreximbank, we started having conversations on how we can finance and actually help and build capacity in the healthcare systems across the continent. Because what we found was that you could have the vaccine, but how do we connect the countries in order for them to be country ready so that they're able to give the vaccine as quickly as possible and not have any issues from a quality point of view. So we're able to connect different countries as Pfizer with different other suppliers to make sure that they had the necessary supply and know-how on how to be country ready in order to be able to receive our vaccines. And the key challenge kept on about equitable access vaccines for Africa. And then we announced an initiative with BioVac to actually produce the vaccine in South Africa, in Cape Town. But that was not only brought up by COVID-19, which brings me to the fact that Pfizer has been present in Africa for over 70 years. We have been in the continent because we believe we are making a difference. And that difference, one of the things we're looking at is when you look at that partnership with BioVac, it was a second product that BioVac was making that was actually an innovative product of Pfizer. So it's not only just the pandemic that's bringing all of those things to the fore. It's around, we believe in partnership and making a difference in the communities that we operate. So I think that's very, very important when you start to look at that. I think Honorable Janine touched on the Zipline project. Zipline, it's a project that we've been quite involved in and making sure that we actually are able to reach some of the challenging locations when we actually need to give product. So how do we manage that last mile? Because usually centrally, you can deliver the product, but how do you take it beyond just the central stores? So I think there's multiple things that we as a company have been involved in. And we continue to look at those emerging threats that are coming up. I think Gwen touched on what's happening with non-communicable diseases. We as Pfizer are looking, how do we make sure that you have capacity and our healthcare professionals are able to diagnose the product? Not only that, but can they have the products that they need to do? So we are working with those in those initiatives and actually trying to make interventions in those areas, because we believe that the healthcare system is not just about the medicine, but it's a system as a whole. So the nurses that get involved, the people that actually provide the support to everyone in the hospital, I think that's quite important for us. So when you look at where we get involved, I think there's a lot more success stories that we can actually share where Pfizer has been involved, but not only Pfizer, but also the pharma industry as a whole. So collaboration, public sector, private sector, other multi-stakeholders in terms of financing and non-governmental institutions really do make a difference in terms of us moving the needle and building that resilient healthcare system that we're all looking for within the continent. Over to you.
Love this collaboration, public-private partnership, and speeding up and scaling up the innovations which are have been proven successful. So, Dr. Karingi, so turning to you now, and with the wonderful work that you are doing with UNECA, so what trends do we observe related to the establishment of better response for future public health crises on the continent? Could you be elaborating on, in addition of sharing, of course, the successes that you have identified?
No, thank you. Thank you very much, Prof. I hope I'm coming through. I'm on the road, so I'm audible and you can see me properly. Now, this week on Monday, we were a group of us and we had an opportunity to visit Institut Pasteur in Dakar. Because we are talking about success stories. And since COVID started, we've heard a lot about what is happening in Senegal. And it was interesting and very encouraging to be able to see it live, because some of the difficulties that our health system has been having, you could actually see some of the solutions coming out of the efforts, like the effort in Institut Pasteur. Now, what do I mean here? We know that the health system, the African health system, one of the reasons why we have been found where we were found is because the kind of inputs we have in terms of the workforce, in terms of financing, in terms of access, we were not at the point where we are supposed to be. So you have very few physicians and nurses serving very many people. You have public sector putting in a very low share of its budget to the health system. But the kind of investment we saw happening at Institute Pasteur is a demonstration that actually it is possible to have the public sector come together with the private sector and actually reinforce each other in a way that some of the innovations that were witnessed can actually be rolled out. So we were able to see the production of a rapid test for COVID-19, preparation for an increase in the portfolio of vaccines that are going to be sold not just in Senegal, but also in ECOWAS and hopefully to the rest of Africa. Which then brings me to the key point that you hinted to. We are actually at a point where we have a framework for a common market for health products that will unlock larger investments in the health system within the continent. And I think for us at the Economic Commission for Africa, we see this as the biggest opportunity that the continent has in terms of building health resilience. And we already have the pillars. The African Continental Free Trade Area that you mentioned is one of the pillars that will make it possible to not only manufacture health products, including devices and pharmaceuticals within the continent, but will also deal with the regulatory issues that make it so difficult for when it comes to trading in health services within the continent. Of course, we also have the pillar of the African Medicines Agency, which of course our member states were able to ratify and for it to come into force in a good time, because this is also going to be very useful in terms of building that health security, so that if you have one innovation, because we talked about innovation, if you have one health innovation in Eastern Africa, that innovation becomes applicable across the continent because you have an African Medicines Agency. Gwen did hint about the AU-led pooled procurement that was used in terms of fighting COVID. I think this is a best practice that, again, Economic Commission for Africa has been very happy to be associated with, including the African Medical Supply Platform, because this also demonstrates that it is possible for Africa not only to create the demand, but have a demand that becomes an off-take demand for whatever else is going to be manufactured under the AFCFTA. So for me, I think the continent is at a good position to take advantage of the opportunities that have actually been exposed by this pandemic. The pandemic has helped us to accelerate some of the pillars that we need to have in building a healthy health system that is resilient. But it has also been able to demonstrate one thing, which I think that's where I would want to add my first intervention. It has actually demonstrated that health is not a social issue alone. Health is an economic growth issue because we have seen African manufacturers being able to take, to have a strong business case for them to be part of the response to the pandemic. But at the same time, we have seen that without a resilient health system, whatever growth you have, even if you say that you've been growing over the last 10 years for more than 7%, it comes crashing down if you do not have a resilient health system. So health is not only a social issue, but also an economic issue. And I think Africa now is well primed to be able to take this forward as we go forward.
I couldn't agree more. And as I highlighted when introducing, the potential impact of quality health on economic development is simply phenomenal on productivity, but also on generating more opportunities. Perhaps let me come back to Honorable Jeanine. And will you mind expanding, Honorable, on some of the policies which has been adopted to accelerate domestic resource mobilization in DRC or in other African countries, and also in better collaborating with the private sector?
Thank you, and I think the experience is diverse, but it's true that we all realize that with the kind of pandemic we had, public authorities and imposing on the public way will not work. So we have seen many calls for mutualization of efforts between public and private sectors. Here in DRC, I will give an example. We had good relationship with some of the African countries. And for example, there were some Eastern Congo countries, and I will not cite them obviously because it's still in process. Some Eastern African countries who's got some good backbone in terms of medical expertise went here in DRC at our request to see whether we can amplify the response and whether we can build on our common efforts to speed up the process. And to speed up the process, not only by bringing the technology, but behind when you call on the private sector, it's because they have the capacity to invest. They have the capacity to invest, they have the capacity to intervene with another type of facilities. And this can be an example. So partnering with some other countries whose private sector has demonstrated a sort of innovation and speediness capacity in front of the viruses.
Fantastic. And perhaps, Dr. Karengi, so will you mentioned the African Continental Free Trade area. Will you mind expanding on the opportunity to strengthen supply chains on the continent to better manage future major increase in demand for medical equipment and supply?
No, thank you, Prof. Let me first of all start by saying that one of the protocols that has been negotiated under the AFCFTA is on trading services. Unfortunately, and I say this because I am a serious believer that we need to open up the trade in services, in health services across the continent. At the moment, trade in health services is not part of the 5 services sectors that have been prioritized. But it's not that, I don't think it's because that the member states did not think that health was important. But I think now with the pandemic, I think everybody believes that we need to open up health services, because to respond specifically to that question, I think had the supply chains been, had we had regional supply chains within the continent, including the value chains for producing to meet the demands under these regional supply chains in the health services, we wouldn't have had the kind of challenges that we had in terms of including PPEs. So the AFCFTA provides an opportunity, at least for regional value chains in the pharmaceutical sectors to emerge. It also provides an opportunity for health professionals, be it nurses or doctors, to be able to move across sectors, across borders. It also provides an opportunity maybe to build those centers of excellence that Gwen mentioned. Now, without an open market for health services, a center of excellence in Nigeria or in South Africa, it may not meet the optimal kind of outcome that is intended if you have the barriers that make it impossible for professionals or even for the goods or the services that are provided through that to come through. So the AFCFTA basically provides the opportunity for us to get a resilient supply chains, value chains, and of course a resilient health system.
Thank you. Rulani, how will you engage with that from a private sector perspective?
So Prof, I'm actually excited Dr. Karingi is touching on this because initially we spoke about regulations. How do we make it possible for things to happen in a much more efficient and effective way? And I think the African Medicines Agency will actually assist in accelerating innovation, that innovation uptake in the continent actually happens. So from our perspective as a private sector, if you could have a strong regulatory agency that harmonizes a lot of the regulations across the national regulations we find ourselves engaged with on a regular basis, I think that simplifies a lot of things, because those are some of the things we saw and we learned from the pandemic, that once you have recognition somewhere and you have a reliance on a certain regulator, things get accelerated in making sure access is quick on the ground. So those are things that I'm excited about, that because also from what Gwen shared around the Center of Excellence in the countries, those are the type of initiatives we want to get involved in, because we're saying rather than having medical tourism, dollars going out or rands or whatever, or naira going out of the continent, let's ensure we build capacity in the continent. So we are getting involved, for example, how do you diagnose metastatic breast cancer as quickly as possible? Can we offer that? And on top of that, these products that are coming in, how do we build payment systems that allow people to have access to it, even though they might not have the financial means, whether it's on the installment system or some kind of a credit line that we give them. So those are things that are exciting, and those are actually opportunities for us as a pharma industry, and particularly for Pfizer. We're looking at those type of things in terms of how do we get involved to support in relation to making sure we build a strong healthcare system.
Fantastic. Gwen, I know that with the Afrexim Bank, you are supporting and working hard to unlock some of those challenges. Will you mind sharing your experience and your perspective on strengthening the supply chains?
Yes, absolutely. Thanks very much for that quite pertinent question. And I think without addressing the challenges and impediments to intra-African trade, all our efforts would be futile. So again, I think if I start with one of the anchor innovations that Afrexim Bank is leading, which underpins the success and implementation of AFCFTA, one is the Pan-African Payments and Settlement Platform. This platform is a revolutionary financial infrastructure which will enable African countries to make payments in local currency. As you know, at the moment, if one African country wants to trade to another, they need to first convert, the buyer converts their currency into US dollar, euro, or sterling. They pay for the goods. The receiver receives this foreign currency, and then they convert it back to their local currency to enable them to then meet their local costs. So what the payment platform will achieve, and it will actually help accelerate intra-African trade, is a buyer in Kenya will be able to pay for goods in Kenya shilling, pay a supplier in Nigeria in naira. So Afrexim Bank, through the network of central banks, will only settle the net dollar amount. So this will also ease pressure on FX availability on the continent, and the continent constantly suffers from this lack of foreign currency, so that we can keep this foreign currency to import those goods from outside of Africa that we cannot yet produce on the African continent. I think estimation at the moment is that we are spending, it is costing around $5 billion through intra-African trade, pressure on dollars on the African continent. So that's quite a cost saving. And then in terms of movement of goods across the African continent, we are all aware of the congestions at border posts, etc. So 7 days to 21 days, I've heard stories of trucks stuck at border posts trying to clear borders for up to 21 days. This is a cost, not just from a monetary perspective, but the delay of getting goods and services to much needed healthcare facilities is an additional cost, including can potentially be a cost to lives as well. So Afreximbank has a product called an interstate transit guarantee, which would enable a truck to move from Cape to Cairo without having to stop to clear multiple borders. So therefore, you save 21 days if that's how long it took a trucker stopping at different border posts and overnighting, etc. It brings down the cost of goods on the African continent, and again, will accelerate trade across the African continent. And then the final point that I would like to highlight is sharing of information. One of the reasons why intra-African trade is so low on the continent compared to other reasons is lack of information. People are not aware to a large extent about what is being produced in one country, what's available in another country that they can access very easily and much cheaper. I always like the example of, somebody from Rwanda purchasing cowhide from New Zealand when a neighboring country is producing very high grade cowhide for, which the Rwandans can then use for high grade leather products. So Afreximbank again is backing an Africa Trade Gateway, which is an information portal which will enable businesses across different African countries to access information about what is being produced in a particular country, what are the regulations to trade with that particular country, etc. And again, all of these innovations collectively will bring down costs and enable Africa to become more self-sufficient. And hopefully, as we create more manufactured goods on the African continent, we also become a global force as a continent when we are trading with the rest of the world. Thank you.
I love it. Thank you very much, Gwen. So turning to what are the opportunities for member states to formulate and implement evidence-based policies that increase cooperation with the private sector? Honorable Janine. You are muted.
Yes, I think that this crisis has taught us a lot about what are the space of opportunities. And for me, for the future, to get a better response to this kind of public health crisis, I think that there may be space of opportunities, like said one of the panelists, which is not just limited to the vaccine, but to the whole system that you build for the vaccine to finally come to the end user. I will just give one example of opportunities, even if it looks distant, but it makes sense. We all know that for the vaccine to be used in all over Africa, it's depending on the cold chain. To keep the vaccine in good quality for its use. And for example, this is simple, but 600 million of Africans still lacks energy and electric power. So how do you make this vaccine arrive in any small villages if the sun is up and the heat is on and that you need a cold chain for your vaccine? The answer is about electricity. So when you speak about opportunities, we should look at not just only the small and specific problem of the vaccine itself, but like said one of the panelists, it's all the ecosystem that you build and where there is opportunities in Africa these days. And I will say electrification is a good example because 600 million Africans will just miss the vaccine or lack electric power today. And if I go back to my country, DRC, if you do forward-looking and come to 10 years up, 10 years in the future, 80% of the citizens, 84 million, will still lack electricity. So no healthcare in the dark. This is for me an opportunity that we have to look at if we want to build system which can be a better response in case of next crisis, because there may be next health crisis. The other opportunity, I think, and we see it with the choice of the panelists that you made, is that we have seen Pfizer told it, African Exim Bank told it, to name these two concrete examples. Better collaboration. Space of opportunity is also the collaboration and the lesson sharing that you build between different type of institutions. That is also an opportunity. We want, for example, of Africa CDC to be pivotal in its role of coordinating private sector and public institution or public decision makers. They've been good at that. They make a difference, they made a difference, and I think that this is an opportunity we should not undervalue. It has no money value immediately, but we've seen that when CDC has started to move, dialoguing with other institutions, it really has an impact. I will also say that space of opportunity will probably arise from this healthcare workers gap that we have. As of today, if I give figures in 2013, for example, the health worker gaps in Africa was about 4.2 million gap of health workers in Africa. If we go in 2030, 10 years up from now, almost 10 years up from now, the gap will be of 6.2 million. And in terms of missing workers, missing health workers in Africa. So you can have all the products, but if you don't address this challenge and you turn it into opportunities, probably your model will fail, your business model will fail. So that's also, I think, it's an opportunity. Yes, I can cite many, but I would like just to show that sometimes we see the surface layer, but we have to go also under the first skin and see that, yes, if we don't have opportunities in terms of electricity, if we don't have health workers, not only at the top level, but midwife, nurses, and any community health workers in a rural village, then we will miss the game. So these are the opportunities I would like to mention.
Those are wonderful, Honorable Janine.
Prof.
Rulani, I will come to you, Dr. Karengi, but perhaps Rulani, from a private sector perspective. So I want to come to you, and then I will go to both Gwen and Stephen to elaborate on how they are supporting or providing those type of evidence to support member state and the private sector. And before going to you, Rulani, perhaps I also want to for the audience, please do not hesitate to ask your question. You can add them in the comment or in the chat section, and I'll be happy to shift or to bring them to our distinguished panelists. Rulani.
No, great. I think the greatest opportunity is coming from how we've interacted during the pandemic. I think we were able to break a lot of walls that were there before. We created a lot of trust. I think from all different stakeholders, public, private, let's continue building these private-public partnerships, because I think we need to take advantage of that momentum. A lot has happened. So when I look at, I spoke earlier about the African Medicines Agency. The impact of getting that right, I think, is enormous, because one country looks at it, registers a product, within a few months, that product is available within the continent. That is something that is unheard of. As I indicated earlier, that in 4 months' time, we actually had a product that was registered in the developed world and immediately available in the African continent. That's one way of it for us to drive that, what I will refer to as universal healthcare. So I think getting some of those basics right, and I think we're on the right direction where you have the member states ratifying what the establishment of the AMA. So I think it's some of those things that we need to continue to do that. What you're also seeing is the private sector is quite willing to say, let's have a conversation to understand what are the challenges and how we can all work together. I think a case in point is how we're partnering with someone. There's multiple initiatives that have come out around this technology transfer for vaccines, et cetera, et cetera. That's private sectors working together with public sector to actually work on those type of initiatives. So I think if you look at the initiatives that are in the value chain from a healthcare provision point of view, there's multiple opportunities that I think the public sector will definitely get involved, provided the regulatory environment is actually enabling, because those are some of the challenges you're finding in the different countries. I think Gwen alluded to 21 days waiting at the border just because of tariff challenges. It's how do we speed those things up in order to enable some of this innovation to really accelerate within the continent. So I'll stop there because I'm just talking from a principle point of view, some of the things we kind of need to get in place and not just the specific things, but if anything to go by, the last 2 years where we've just gone through a pandemic, it just indicated how we can partner together as public-private and also other stakeholders in order to bring to strengthen our healthcare systems.
That is wonderful, Dr. Karingi.
Yes, so I was going to talk on this opportunity and also what we are doing as CCA. So the role of the private sector is an opportunity. And I was going to give you some example. We did some market sizing of some of looking at the disease burdens in the continent, both in maternal, neonatal, and child health, and also on hypertension. Now, as you know, most medicines that are consumed in Africa are produced elsewhere. Imports of medicines and also medical equipment actually rose at an average rate, at a compounded annual growth rate of 18.8% between 1998 to 2018. And so this presents in itself a huge business opportunity for African manufacturing. Now, so we try to estimate the size of this market for maternal, neonatal, and child health products, and also for the hypertension market. And what we found out is that in a base case, in 2020, you will have we had a market of about 6.2 million for oxytocin. Now, this rises to about 29 million in 2050. That's a base case. But in an ideal scenario where you are meeting now the needs of all the women who need to have high quality oxytocin when they are giving birth at any particular time, the ideal scenario would be that by 2050, we have about $41 million in terms of a market for oxytocin, which is an opportunity for the private sector. And lastly, in terms of the antihypertensive medicines, because you heard about the non-communicable diseases, whereby we have to deal with it as a part of our health system. In the base case in 2020, we had a market for antihypertensive medicines of 5.3 billion, which would rise to about 9 billion in 2030. That's in a base case. But if you are to take care of every African who needs to be able to have access and in an affordable way to hypertensive medicine, the ideal scenario for 2020 should have been that we have about that $1 billion worth of market, which rises to about $52.3 billion by 2030. So this creates an opportunity, and this is the kind of work we are doing, and we are supporting some of the farmer farms, the small ones within the continent, to expand their manufacturing, of course, by helping them to prepare their business plans so that Afreximbank and other financiers and investors can actually be able to come in to take care of this market. Thank you.
Wonderful. I really love how you show this very specific opportunity for the private sector, not just to address, and first to address key challenges that the continent is facing. In the meantime, that they will also be generating value. So Gwen, perhaps before just asking you, and you may expand on this question, but I also want to bring a question asked by Bronwyn from ARC. The continent is going through harmonization efforts in the health sector, including that of medical products regulatory agencies. Recently, the African Medicines Agency ratified, so as an illustration. And what do you think about the opportunity to harmonize supply chain in the continent as well, building from there? And the African Resource Center has a model that they provide there. So can you both elaborate on those opportunities and sharing your experience on how you are helping unlocking the private sector in the private healthcare sector, as well as addressing this question from the Africa Resource Center. Gwen?
Yes, thanks very much. And maybe I'll start with just a couple of comments on the opportunity that Africa is faced with. And I agree with the comments of the fellow panelists. You know, the pandemic, whilst it was a curse for many of us, has also been a blessing because it's opened our eyes to the opportunities and the steps that we need to take in order to protect Africa's health security. And if I speak about vaccines in particular, and some of the panelists have alluded to this, manufacturing of vaccines, technology transfer on the African continent, I think is a logical next step as we start to transition out of a pandemic into an endemic. So Afreximbank is already working with large manufacturers and private sector players already in the pharma industry to bring them together to see the opportunities that exist for establishing COVID-19 vaccine manufacturing capacity on the African continent, and not just fill and finish under contract, but actually under full license and technology transfer. Because what the pandemic showed us was that because we didn't have the ability to manufacture those COVID-19 vaccines on the continent, Africa was nearly left miles and miles behind. But beyond COVID-19, we can also use this opportunity with the same manufacturing facilities to expand that manufacturing to other important vaccines, which Africa is a huge consumer of potentially. Things like HIV vaccine, the malaria vaccine, tuberculosis vaccine, all of these things, Africa is probably the largest consumer once these are widely available. So why not have that manufacturing capacity on the African continent to combine that with a COVID-19 manufacturing facility so that you have a sustainable project rather than financing and building projects that are then not sustainable because you don't have uptake, have a nice diversified portfolio of key vaccines, and even traditional childhood vaccines, which are already being imported onto the African continent. All of these can be expanded for manufacturing onto the African continent. And then coming to the question around harmonization, if I speak generally, because I'm a banker and by no means an expert in medicines and medical related facilities, but I think harmonization in any context is usually a very, very positive step, which also leads, apart from harmonization, there's partnerships. But if you have harmonized standards, for example, you're more likely to hit best practice, be more unified, and be able to have a stronger supply base to reach the masses. Because if you don't harmonize, you may have products that are not fit for purpose across the board, so you have pockets of excellence. But if you harmonize, you can all aspire to the highest standard available through that harmonization. Thank you.
Fantastic. So I will go to the next round of questions, and I will probably give the opportunity to each panelist for a minute of conclusion. So we have a question from Jean Narcisse, and the question is, what is the role of good governance in increasing healthcare effectiveness on the continent, and mentioning that, for example, Africa is not able to raise the necessary funding to support the healthcare sector. And he's also expressing, congratulating for the great panel. We have also Francine Semete, who's mentioned that how can we address the healthcare challenges in Congo? And finally, we have another question related to if the increase in government expenditure is the answer for the continent, and what should be the role of the private sector. We have discussed this briefly, but let me to conclude, I will just give a a minute maximum to each panelist to say the final words. So starting with Honorable Janine.
Yes, I think that COVID-19 issue and the way African countries and country states manage the characteristic of what build good governance in managing any product which is destinated or which is addressed to the citizen or the community stay valid. I don't see why, because it surprises. We should give up all the criteria of what is good governance. I think that all citizens want to see that if there is some donors providing money to fight against the pandemic, that's the money it's conveyed directly to the end user, which are the citizens. So for me, good governance should be embedded in the strategy, the answer, and the way or the methodology that everybody applies, whether it's public or private sector, to make sure that yes, all of our people are vaccinated. Maybe the pressure of the crisis if creating some place, somewhere, sometimes some slippage, but it should not be an excuse. I mean, the crisis and the pressure of the crisis should not be an excuse to give up about the good governance principle. And I think that all the panelists do agree, because we have also to build this story of Africa being portrayed sometimes as countries where good governance issue in different domains are not well met. But we all know that it's not just true for Africa. It's just more portrayed and mediatized if it is about Africa. Then secondly, there have been issue about the healthcare challenges in Congo. Is that correct, in DRC? Yes.
Absolutely. And honorable, probably briefly, and I will also ask the other panelists, 30 seconds will be left for just addressing very briefly the question. Yeah.
Yes, I mean, we could not end up the conversation about healthcare challenge in Congo. I don't want to defend Congo or to find an excuse, but it's very true that if you have been a post-conflict country for 20 years, all your system has been disorganized. If you have a country which has the size of European Union, here I'm in Kinshasa, but if I want to address the issue of the vaccine or Ebola in Eastern Congo, it's like if I am in London and I need to go to Moscow. So that is the challenge that Congo faces. It's not an excuse for not doing anything. I think there are a lot of initiatives done, but probably it's not perceived as yet impactful, given the size of a country with 26 provinces and almost 100 million people. So for today, that's what I can say. Thank you.
Wonderful. Thank you so much, Excellency. And perhaps the other panelists, just a sentence, a concluding sentence. Starting with Rulani.
Okay, no, thanks, Prof. I think from a Pfizer perspective is that the sentence is we are committed in building a resilient healthcare system, because that's the only way we can actually live up to our purpose of actually bringing breakthroughs that change patients' lives. And we won't do it alone. We need the private-public partnerships, because that's how we can achieve more other than just by ourselves.
Wonderful. Gwen?
Thank you very much. I think for me, my closing sentence would really be around the fact that we need to drive Africa's growth through industrialization and manufactured products on the African continent, and move away from our historic culture of exporting raw resources out of the African continent. We manufacture on the continent and trade more amongst ourselves. Thank you.
Fantastic. Dr. Karingi?
So my sentence is there is excessive reliance on external financing of the health in the continent. Yet health, when looked at as part of the economy and as a contributor to growth, it can actually help in the financing of the economy. So my final word is health and economic growth are endogenous, and they are one and the same. You can't have one without the other.
That is fantastic. A wonderful way to conclude this panel. So we have highlighted the critical importance of trade, multi-stakeholder collaboration among others. I will not come back to those very insightful points. Allow me instead to give the floor to Dr. Jeffrey Storchio, Chairman of CCA, who will be providing the concluding remark for this panel. Dr. Jeffrey, you have the floor.
Thank you, Landry. It's really been fascinating to listen to this conversation. I was reminded of a book that came out a couple of years ago by Charlene Hunter-Gault called New News Out of Africa. And in that book, she lamented that most of the stories that came out of Africa in the 80s and 90s were about disease, disaster, and despair. And she was arguing that there actually is a much more positive story coming out of Africa. She was writing in 2006 about democratic reform, economic development, improvements in education and health systems, and that actually it was a much more positive story. Well, today's discussion tells us of some new news about resilient healthcare systems and the factors that are making it possible for us to see more progress in that area. So I wanted to just summarize two key areas that our panelists talked about. One was creating the enabling ecosystems that make it possible to do more in healthcare. The Honorable Janine Mabunda-Lioko spoke to us about how the African Union is now speaking with a united voice about everything from the need for vaccine equity with response to the COVID pandemic to how they're going to work together to create the systems that will make it possible to build healthcare systems that do a better job of creating the systems that Africans want and need. We spoke about the African Free Trade Agreement, Continental Free Trade Agreement, which is going to make trade in health services and products much less frictionless across the continent. The Afreximbank has been doing a lot of work on guarantees and creating African Centers of Excellence, the settlement platform that Gwen Amwaba talked about. These are tools that are making it possible to provide for easier trade and easier investment in healthcare across the continent. And then we have the African Medical Supplies Platform, the African Centers for Disease Control and Prevention, and the new African Medicines Agency, which are going to make it possible for better harmonization and more readily accessible healthcare solutions across the continent. So that's on the level of enabling ecosystems. The other theme that came out of our discussion that we heard from all of our speakers about was the importance of taking advantage of the opportunity space for more public-private collaboration. And we heard many examples of this. I'll just use two. That Zipline has been finding ways to use drones to reach the last mile in a number of countries. That's a very interesting collaboration among a new startup with companies like Pfizer and other major pharma companies, as well as governments making this possible. And we're seeing efforts now to create mRNA technology and manufacture COVID vaccines in Africa. Pfizer's collaboration with BioVac, and there are other efforts that are underway now to do that as well. Those are just two salient examples of this kind of public-private collaboration. But that collaboration will continue, and it offers Africa an opportunity to build on the opportunities and successes we've heard about to create a sustainable success in building resilient healthcare systems in the future. So on behalf of the Corporate Council on Africa, I just want to thank all of our panelists and our moderator for a very stimulating discussion. It's given us lots of food for thought, and we look forward to continuing these conversations over the coming months. So thanks, everyone, and enjoy the rest of your day or evening.